Hello, everyone. My name is Dr. Chidi Emeka. I'm the president and the CEO of Hope for the Needy and Evangelical Foundation, Incorporated. Hope for the Needy is a charity, nonprofit organization based in Maryland, United States. I'm licensed to practice here in the United States. My specialty is foot and ankle. This presentation is in line with what we do as an organization, which is to help people. Our website is Hope for the Needy and Evang.com. You can see it on the screen. You guys can check it out. We will be talking about plantar fasciitis. In a layman's language, is called heel pain. So, what is this plantar fasciitis? Plantar fasciitis can be defined as an overuse injury to the plantar fascia and the peripheral structures, which causes micro tears and inflammation to the involved tissues over time, or simply an inflammation of the plantar fascia secondary to excessive tension and overuse. In the absence of inflammation, plantar fasciitis is best described as a plantar fasciosis, which is nothing but a degenerative condition. The plantar fascia is composed of three bands, which are the lateral, the central, and the medial band. The central band, which is the thickest and the strongest, divides into 5 slips, and each slip divides into a superficial and deep tract. The plantar fascia originates from the medial tubercle and plantar surface of the calcaneus and inserts in the flexor sheath, volar plate of the base of proximal phalanx of digits 1 to 5, and the skin. Heel lift with ankle plantar flexion and metatarsal phalangeal joint dorsiflexion tightens the plantar fascia, raises the arch and shortens the foot, and assists in the resupinating the subtalar joint during the propulsive phase of gait cycle, a mechanism known as Windler's mechanism. The Windler's test, extension of all the metatarsophalangeal joints, significantly increases strain in the plantar fascia and also in the tibial nerve, and LPM and MPN. LPN is lateral plantar nerve and MPN is medial plantar nerve. The average range of motion at the first metatarsal phalangeal joint at this period is 55 to 85 degrees, which is as a result of heel extension, knee flexion, and ankle plantar flexion. Plantar fasciitis needs to be differentiated from the non-mechanical inflammatory pathologies such as rheumatoid arthritis, gout or pseudo gout, ankylosing spondylitis, psoriatic arthritis, neuropathy of the first branch of the lateral plantar nerve, calcaneal stress fracture, tunnel syndrome, Mayer-Strom-Pell disease, Paget disease, Reuters syndrome, Behcet syndrome, arterial insufficiency, SLE, inflammatory bowel syndrome, and unicameral bone cysts. Others are plantar heel pain syndrome, heel bursitis, heel spur syndrome, subcalcaneal pain, and chronic plantar heel pain. Plantar fasciitis uniquely presents with a pain which is felt most times at the plantar arch along the course of the plantar fascia. The heel pain is most severe on arising in the morning, and this is known as post-static dyskinesia. The symptoms tend to increase as more time is spent on weight bearing. Local tenderness in the area of the central band, medial calcaneal tubercle, and other areas of the fascia are frequent findings with post-static dyskinesia. So now, what are the causes of this plantar fasciitis? There are many and they vary from person to person. Significant amongst the causative factors are overuse and increased stress on soft tissues and joints on the plantar aspect of the foot, which is directly related to increased weight and stress on the plantar fascia, commonly found but not limited to obese individuals. Other common causes are increased athletic activity, flat foot, which is paraplanus, concavus, which is high arch foot, rigid, rigid foot, poor supporting shoes, this very high pointed heel shoes. Another one is large weight gain like in pregnancy and normal aging. A study indicates that an increase in hamstring tightness may induce prolonged forefoot loading and through the windlass mechanism be a factor that increases repetitive injury to plantar fascia. A study also correlated positively pain to fascial thickness and arch angle. That's when the pain fascial is thick and large arch angle. What are the treatments for this plantar fasciitis? There are many treatment modalities available, which is divided into conservatives, the non-invasive treatment of plantar fasciitis, intermediate, which is also non-invasive or a little bit invasive, then surgical treatments, which is highly invasive treatment. And we are going to stop here so far. So our next video will gear towards dissecting or explaining in details some conservative treatments of this heel pain, one by one. We're going to explain them one by one. That is the things you can do at home to help you with heel pain. Here we are going to draw the curtains. Thanks for watching. If you enjoyed and like this video, please give it a thumbs up, like it, share it, subscribe to this channel. Also push the alert button so you can be notified anytime we put out videos like this. I would like to ask that we need your big hand to change our world, and please do donate if you can to change someone's life. Thank you. See you on my next video. Hey. Hi everyone. I hope you're okay. You're doing good. And today we're going to look at a topic that says easy and effective home treatments for heel pain or plantar fasciitis. And my name is Dr. Chidi. I'm the president and the CEO of Hope for the Needy and Evangelical Foundation Incorporated. It is charity, a non-profit organization in Maryland, USA. I am licensed to practice here in the United States, and my specialty is foot and ankle. This presentation is aligned with what we do as an organization, which is to help people. Our website is Hope for the Needy and Evangel.com. You can see it on the screen too, so check it out. Today's presentation is a continuation of our last video on plantar fasciitis, which is heel pain, and that was in January this year. We would have put out this video before now, but for circumstances beyond our control, we couldn't. So a recap of the last video. What we did in the last video is what plantar fasciitis is and what it is not, the causes and the treatment modalities. I'll advise that you get and watch that video if you can before you dive into this one. It will make more sense, hopefully. The video is on our website, that is which is Hope for the Needy and Evangel.com. Today we will concentrate on the things one can do at home to alleviate or at least help with the heel pain before going to see your podiatric physician or a medical practitioner. This is my references. Before we talk about the treatments, I'd like to look at some of the preventive measures. Prevention, they say, is better than cure. So we're going to look at prevention. First on the list is to always wear the proper shoe for any activity. Don't use a dress shoe for an athletic activity. I mean, it won't work. I mean, it's going to be a problem. Do not wear shoes with excessive wear on heels or soles. Prepare properly before exercising. For example, warm up and do stretching before and after running. If running is an exercise you want to embark on. Pace yourself when you participate in athletic activities. Don't underestimate your body's need for rest and good nutrition. And if you're obese, lose weight. You all know that this is better said than done. And avoid long work with very high pointed shoes. This is for females. Then we have treatment. We mentioned various treatment modalities in our last video. This is just a recap. We talked about conservatives, treatments, intermediate treatments, and surgical treatment. Conservatives are the non-invasive treatments, and they are NSAID, just anti-inflammatory drugs, call it steroid injections, stretching, taping, strapping, padding, heel pads, night splints, orthotic devices, rest as limit normal daily activity, ice, massage, rolling the bottom of the foot on a plastic ball. Physical therapies can be used in conjunction with all these mentioned treatments. Then we go to the second treatment modality, which is intermediate. You can say slightly invasive. They are extracorporeal shockwave therapy, ESWT for short. Cast immobilization, plantar fasciitis, autologous platelet concentrate injection, botulinum toxin injection, acupuncture, weight loss, etc., etc. Then the surgical, which is grossly invasive. They are endoscopic or open plantar fasciotomy, spore resection if indicated, removal of neuroma or the soft tissue growth where necessary. There are many studies supporting some of these treatment modalities, but I will not be discussing these studies in this presentation. We will be concentrating on various simple things one can do at home to alleviate or help with the foot or heel pain before one can go to get a help from a foot specialist or a medical practitioner. There are 10 in numbers. Number 1 on my list is seated towel stretch. To do this, you have to sit down with your injured leg straight in front of you. Then loop the towel or band around your injured foot. Grab hold of the towel or band with both hands, like you're holding onto a horse ring, and gently pull your foot towards you, keeping your knee very, very straight. Hold the stretch for 15 to 30 seconds. Then relax and then repeat these 3 times, twice a day and 5 days a week. The muscles worked on are the posterior tibial, which is the back leg muscles, tibialis anterior, the front leg muscles, Achilles tendon, the muscle that connects the back of the knee to the foot, then the plantar fascia and the intrinsic muscles of the foot. Strengthening your feet and keeping them flexible is essential to reducing a heel pain on plantar fasciitis. This move should feel especially very nice after a long day on your feet, especially for those of you who stay a lot on their feet in their workplaces. Then number 2 is frozen water bottle drills. Ice is an excellent tool in the fight against heel pain. It reduces pain and inflammation, and it can feel very refreshing on a very hot day. The liquid roll move is a drill action. The first action is getting a massage, and the second one is the cooling therapy you can get from it. Massaging provides relief by stimulating blood flow to the area being massaged. It also helps to relax the muscles, like in stretching. What are the things needed for this? First is a frozen juice can or a frozen water bottle. You can wear socks to put a layer between you and the ice if the can or bottle is too cold for you. You can also do this with a tennis ball, but you'll only get the massage aspect of it. So first, what you do, sit straight on a chair. You can hold onto a sturdy item for support. Then number 2, push your bare foot on the juice can or water bottle slowly. This is action number 1. Then roll your foot back and forth for a minute. This is action number 2. Repeat this 3 times a day, 5 days a week, or until the discomfort of your pain stops. Muscles worked on are the plantar fascia and the intrinsic muscles of the foot with this exercise. My candid advice to you is to see a podiatric physician or a medical practitioner if all the home things we're going to discuss in the series do not help you with your pain. Here we're going to draw the curtain, and for our next videos we're going to be dealing with the other remaining exercises and stretching you can do at home to help you with your heel pain. If you enjoy and like this video, please give it a thumbs up, like it, share it, and subscribe to our channel. And push the like button too, so you can be notified anytime we push up videos like this. Now this will also encourage us to continue to produce videos like this. Thanks for watching, and I want to say we need your big hand to change our world. Please donate if you can to change someone's life. We have a donate button on our website where you can do this, where you can donate. Again, thanks for watching. See you on my next video. Bye for now. Hi everyone. How are we doing today? Hope good. So today we're going to still talk about plantar fasciitis. This is the third video we're doing on this same topic, but today we're talking about the easy and the effective home treatments for this plantar fasciitis, which is heel pain in a layman's language. And my name is Dr. Chidi. I'm the president, the CEO of Hope for the Needy and Evangelical Foundation Incorporated. Hope for the Needy is a charity nonprofit organization in Maryland, United States. I am licensed to practice here in the United States, and my specialty is foot and ankle. So this presentation is in line with what we do as an organization, which is to help people. Our website is Hope for the Needy and Evang.com. You can check it out. Okay, today's presentation is a continuation of our video series on plantar fasciitis, which is heel pain. We've already discussed what plantar fasciitis is and what it is not. We also talked about the various treatment modalities, prevention, and things one can do at home to prevent, to help with this pain. That's the foot or the heel pain. This is the third video we're doing on this, and I will advise that you watch the whole series. That's the number 1, number 2, and this number 3 video for maximum benefit. All the videos can be found on our website and our YouTube channel. So today we're going to concentrate on the things one can do at home to alleviate or at least help with this heel pain before going to see a doctor, a medical practitioner. These are my references. There are many studies supporting most of the things we have talked about and are still going to talk about on this heel or foot pain, but I will not be discussing the studies. So let's dive into the presentation proper. There are more than 10 in numbers the things you can do at home to help you with heel pain, but number 1 on my list is seated towel stretch. We've already discussed that in a previous video. And number 2 is frozen water bottle rolls. We've also discussed that in my previous video. So this is number 3, and that's what we're going to do today. Number 3 is hip hovers. So what is this hip hovers? Hip hovers targets the muscles in your hips and pelvic areas. Building strength in hip and pelvic muscles help a lot in preventing heel pain. Weak gluteus medius, which muscle along the pelvis, causes the body to begin to tilt inward, thereby placing excess weight on the arches of the feet, which can cause the arches to fall. This can as well damage the plantar fascia, which is the foot muscles. This can be performed on a yoga mat or any flat, hard surface on the floor. Make sure to keep your upper body relaxed and motionless as much as you can to isolate this movement. So now the exercise proper. First of all, rest flat on your stomach with your legs outstretched behind you. Number 2, then stack your arms under you in a mat shift pillow and rest your head on your arms. Then pull your navel in towards your spine and tighten your abs. Abs are the muscles around your stomach. Next, on your induced side, that's your leg, it could be the left or the right leg, tighten your buttocks and thigh muscles. Then hover this leg about 8 inches off the floor. Hold it for 5 seconds. Then lower your leg and then relax. Do 2 sets of 15 and repeat same on the other leg if both feet are bothering you. This can be done 2 to 3 times a week. And the muscles worked on are the gluteus medius, gluteus maximus, semimembranosus, and semimembranosus, which are the hip and the pelvic muscles. Then number 4 is what we call wall calf stretch. Wall calf stretch. Tight calves contribute to foot or heel pain. So one of the top causes of calf tightness is sitting. And we sit a lot. Think about how much time you spend sitting each day. How much time you spend studying or sitting at the office or in your car or at the dining, eating or watching TV, video or Netflix, and so on and so forth. It's hours on ending. So this exercise targets the calves. And building flexibility and strength in your calves muscles can reduce foot or heel pain over time. So to start, find a wall. Then stand and face a wall. Then place your palms on the wall at your eye level. Next, keep your injured leg back and keep your heel on the ground. Then move your other leg forward and bend your knees. Then rotate back your back foot slightly. Then slowly lean towards the wall until you feel a stretch in your calf muscles. Then your back leg should be mostly straight. Hold the stretch for 15 to 30 seconds. Then return to the starting position and repeat this for like 3 times. And you can do this like 3 times a week. And muscles worked on this exercise are the Achilles tendon, medial gastrocnemius, and plantaris muscles. These are back and medial leg muscles. Then we have another one. That's the number 5, and it's called monkey foot towel lift. Monkey foot towel lift. This is a great way to strengthen your arches and increase flexibility throughout your feet and your toes. Many people's toes spend much hours a day scratched in their shoes. Although plantar fasciitis pain occurs in the heel, the toe play a vital role in it. So, making space and spreading the toes can help relax other muscles in the feet, thereby reducing the plantar fascia pain or reducing the heel pain. You need a chair and a small towel or cloth to perform these front and foot strengthening toe stretches. First of all, sit on a chair and place a towel on the floor in front of you. Then keep your heel bone on the floor or the ground and lift the towel with your toes. Then release the towel and repeat this 10 to 20 times and maybe 3 times a week. You can make this more challenging by placing a little heavy object on the towel you're gonna lift, And in this exercise, the muscles worked on are the posterior tibial tendon, the abductor hallucis, and the plantar fascia. These are foot and leg muscles. Then number 6 is what we call ballet raises. The ballerinas, how they raise their heels. That is where this comes from. So this move uses chair. It builds flexibility in the foot and the calves. This is very effective because the calf muscles and Achilles tendons are attached to your heel bones, which are attached to the plantar fascia. Plantar fascia is the foot muscle. Then, relaxing your calf muscles can create a chain reaction of reduced pain. So for this, you need to use a sturdy chair as a makeshift ballet bar. Like the tip-toe balance, you can choose to do it with or without shoes. First of all, stand behind the chair and place both of your feet flat on the floor. Then use the chair as a support as you raise onto your tiptoes and hold for 5 minutes. Then slowly lower yourself down. Do 2 sets of 15 and rest for 30 seconds between sets. And the muscles working on this exercise are the Achilles tendon, the medial gastrocnemius, plantaris muscles, and plantar fascia. All these are leg and foot muscles. And this is where we're going to stop for today. We're going to draw the curtain today. Our next video will deal with the other remaining exercises or stretches you can do at home to help you with your heel pain. So, if you enjoy and like this video, please give it a thumbs up. Like it, share it, and subscribe to our channel. And also push the alert button so you can be notified anytime we push out videos like this. Thanks for watching, And I just want to say that we'll need your big hand to change our world. So please donate if you can to change someone's life. You have a donate button on our website where you can do that. Again, thanks for watching and watching. So see you on my next video. Bye for now. Hi everyone. How are we doing today? Hope fine. My name is Dr. Chidi. I'm the president and CEO of Hope for the Needy and the Evangelical Foundation Incorporated. It's a charity nonprofit organization here in Maryland, United States. I'm licensed to practice here in the United States, and my specialty is foot and ankle. Foot and ankle. This presentation is aligned with what we do as an organization, which is to help people. Our website is Hope for the Needy and Evang.com, so you can check it out. Again, it is Hope for the Needy and Evang.com. You can see it on the screen too. So today our presentation is in line with what we've been doing for a while on plantar fasciitis. Actually, today's presentation is number 4 on this series on plantar fasciitis, and it's still on the easy and effective home treatments for plantar fasciitis. I will advise that if you have not watched the previous videos, this is number 4. You go back and watch those videos. You can find those videos in our YouTube channel and also in our website, which is again Hope for the Needy and Evang.com. We are still on the things one can do at home to alleviate or at least help with heel pain before going to see a physician or a medical practitioner if the pain persists. This is my references. There are many studies supporting most of the things we have talked about and are still going to talk about today, but I will not be discussing these studies. So let's dive into the presentation proper. There are more than 10 things you can do at home to alleviate this plantar fasciitis pain, and already in our previous videos we have discussed like 6 of them. Number 1 is seated towel stretch. The number 2 is frozen water bottle rolls. Number 3 is hip pivots, and number 4 is wall calf stretch. Number 5 is monkey foot towel lift. Number 6 is ballet raises. We've discussed these 6, and today we're going to just go over the remaining 4 on this series. So number 7 is what we call sideways leg lifts. Sideways leg lifts. You see, everything is connected in the human body. The hips and the legs can contribute to pain in your feet if anything goes wrong with them. When hip flexors and thigh muscles are strengthened, they can improve one's posture and the way weight are distributed to the feet. This move targets the leg muscles. It provides a long, lean stretch and builds strength as well. Then the stretch, it's proper. This is performed on the floor or a mat. So let's go. First of all, rest on your side and relax your head down on your lower arm. Then straighten your legs and stack them on top of each other. Next, clench your front thigh muscles on your upper leg. Next, lift your upper leg 8 inches away from the other leg. Keep this leg straight as you slowly lower it. Do 2 sets of 15 a day, 3 to 4 times a week. And muscles worked on are the gluteus medius, the gluteus maximum, the iliacus, the psoas major, the adductor magnus, the semitendinosus, and the semimembranosus. These are hip and leg muscles. Then number 8 is crossover fascia stretch. Crossover fascia stretch. This move focuses specifically on the muscles in your feet. The more stretching you do, the more flexible your ligaments and muscles in your feet and leg will become. You see, increased flexibility in your feet reduces the likelihood of injury. For this particular stretch, you will need to sit on a chair. This is a pain relieving crossover stretch. First of all, cross your injured foot over your other knee. Next, grab hold of your toes and pull them towards your chin until you feel a stretch in the arch area of your foot. Then hold the stretch for 15 seconds and repeat this 3 times. You can do this 3 to 4 times a week. The muscles worked on these are the posterior tibia, the flexors, the Achilles tendon, the plantar fascia, the intrinsic muscles, and tibialis anterior. These are leg and foot muscles. Then number 9 is known as reach and stretch. Reach and stretch. This is a calf strengthening move. This one tests your balance. It also targets the lower leg muscles. And avoid going barefoot on a hard surface with this one. Rising up on one foot at a time isolates the movement and allows for a deeper stretch. And being up on your tiptoes provides a nice stretch in the plantar fascia, that's the bottom of your foot. Then the stretch proper. You can do this either barefooted or in an athletic shoes if you like. If the stretch in your foot gets too much while barefooted, then try it again while using a pair of supportive shoes. Understand? And you will need a sturdy chair either way, whether you want to do it with a supportive shoes or do it on barefoot. First of all, stand next to the chair with your injured leg farther from the chair. Then stand on your injured foot and bend this knee slightly. Raise the arch of your injured foot while keeping your big toe on the floor. Keep your foot in this position. Now bend at the waist and reach forward with your hand on the same side as the injured foot. Lastly, avoid bending your knees at this time. You have to keep your knees straight at this point. Do 2 sets of 15 and 3 to 4 times a week. To increase the stretch difficulty, reach further in front of you. And the muscles worked on here are the Achilles tendons, the medial gastrocnemius, plantaris muscles, and plantar fascia. All these are leg and foot muscles. Number 10, which is not the least, is known as step up arch extension. Step up arch extension. Some cases of plantar fasciitis are caused by fallen arches of the foot. The arches of the foot are supported by the tendon called the posterior tibial. The weakening of this tendon is usually due to damage, injury, or any kind of inflammation, and so on and so forth. This causes the arch to begin to fall. You can prevent or treat this by this step or stretch arch extension, which is what we're going to do now. This move targets and strengthens the posterior tibial tendon, plantar fascia, and the calf muscles. All these are leg and foot muscles. The stretch proper. First of all, you will need to wear athletic shoes for arch support. You'll also need a staircase or a step. Stand with the ball of your foot on a stair. Lower your heel towards the step below until you feel a stretch in your arch. Then hold the stretch for 15 to 30 seconds and repeat this 3 times. You can do this 3 to 4 times a week. The says practice makes perfect, and practice also reduces pain. The muscles worked on here are the posterior tibial tendon, the plantar fascia, the Achilles tendons, the medial gastrocnemius, and plantaris muscles. All these are leg and foot muscles. So this is my candid advice to help you with little or very minor pains before and after these stretches. You can take over-the-counter non-steroidal anti-inflammatory drugs. We call it NSAID for short. That is 30 minutes before the stretches or after the stretches. Make sure your primary care doctor approves of the NSAID if you are on some medications to avoid any adverse effect of drug interactions. So here we're going to draw the curtain for today. Hope you enjoy this. Then our next videos will deal with home care of your diabetic foot. That is how to care for your feet at home if you're diabetic, or assist elderly family members who are diabetic care for their feet at home. That's the simple things you can do to avoid about the feet, to be on the safe side. If you enjoy and like this video, please give it a thumbs up, like it, share it, subscribe to our channel, push the alert button so we can notify you anytime we push out videos like this. Thanks for watching. And I would like to say that we need your big hand to change our world. Please donate if you can to change someone's life. We have a donate button on our website where you can do that. Again, thanks for watching. See you on my next video. Bye for now.